Zepbound, the newest weight loss injection, offers promising results for weight loss and the fight against obesity. But it's an expensive treatment, and the financial aspect cannot be overlooked. Whether you plan to get it with insurance or pay out of your pocket, understanding the costs of Zepbound is important, especially since it's a long-term treatment you may need for months or even years to yield the results you're looking for.
It works by slowing down digestion, by having the brain think the stomach is full, and thereby reducing appetite.
So let's break down the specifics. How much does Zepbound cost without insurance? As long as you have a valid medical prescription for Zepbound, you do not necessarily need health insurance to get your treatment. You can purchase it on your own and pay out of your pocket. However, be aware that Zepbound is an expensive weight loss medication with costs exceeding $1,000 per month if you're not covered by insurance. Yet, Zepbound is on average 20% cheaper than other GLP-1 medications and obesity medications like Wegovy, Ozempic, or Mounjaro, for example. But let's be specific and check out the actual costs of Zepbound without insurance, depending on where you choose to buy it. Eli Lilly, the manufacturer of Zepbound, has set the list price at approximately $1,059 for a month's supply. This price covers a package of 4 pre-filled single-use injection pens, regardless of the dosage. For you to understand better, the list price of a medication, also referred to as the sticker price, is the manufacturer's suggested retail price for a medication before any discounts, rebates, or insurance coverage is applied. In other words, it is the price Eli Lilly suggests pharmacies sell Zepbound to their customers. The list price does not usually reflect what most consumers will pay and often does not include charges related to distribution, dispensing, or taxes. Besides, the actual amount a patient ends up paying for Zepbound also varies widely depending on insurance coverage, pharmacy markups, discounts, coupons, and patient assistant programs. For instance, you may be able to pay as little as $25 for a 1-month, 2-month, or even 3-month supply of Zepbound with insurance coverage. And even if you don't have coverage, you may be eligible for the Lilly Assistance Program and pay only 50% of the list price for a monthly prescription. But we'll talk about that later. First, let's check how much Zepbound costs without insurance at different pharmacies. Zepbound costs at the main pharmacy chains. We've done our homework and checked it out for you. When purchasing Zepbound from major pharmacies such as CVS, Walgreens, Wegmans, Safeway, Costco, and Rite Aid, on average, you will encounter prices ranging from $1,000 to $1,400 for a monthly supply. That's quite a wide range, we know, but a medication's retail cost always varies depending on the different markups applied by each pharmacy. That's why it's always a good idea to compare Zepbound prices across different pharmacies in your area to find the best rate available. Zepbound cost at major online pharmacies. Zepbound is also available at online pharmacies with medical prescription. Platforms like OptumRx and Express Scripts may even have prices competitive with those of local pharmacy stores. Checking the price of Zepbound on these online platforms can sometimes yield savings, especially if they provide specific discounts or promotions, which is often the case. Zepbound cost directly through Eli Lilly. In January 2024, Eli Lilly, the manufacturer of Zepbound, has launched an innovative direct-to-consumer service with your own telehealth and pharmacy service called Lilly Direct. You can now purchase Zepbound online directly from its manufacturer at its list price. You may also be eligible to own their Zepbound Assistance Program and pay only 50% of the list price for a monthly prescription. You can register online and ask your doctor to send your Zepbound prescription directly to Lilly Direct. You can also connect with Lilly's partnering healthcare providers online and get your medical consultation and prescription there, but extra fees will be applicable. Zepbound cost at Amazon Pharmacy. Zepbound is now available at Amazon Pharmacy as well, where it costs $1,301 for a monthly supply with insurance prices available. We are quite above the $1,059 recommended list price, making Amazon Pharmacy definitely not the cheapest option for now. How much does Zepbound cost with insurance? Most people looking to get Zepbound will likely do so through their health insurance to cover the high costs. But you should first make sure that Zepbound is covered under your insurance plan. Depending on your policy, you might find that your tirzepatide injections are fully or only partially covered. Zepbound's cost with insurance may sometimes be as low as $25 for a month's supply, but on average, insured patients can expect to pay anywhere from $25 to $550 per month for Zepbound, largely depending on whether their plan covers the medication and to what extent. How to get approved for Zepbound coverage? First, it's important to understand that not all insurances cover Zepbound and similar GLP-1 medications for weight loss. It depends on your plan. Then, getting your health insurance to cover Zepbound costs typically involves a process called prior authorization. This is not always the case, but often it is. This process requires your healthcare provider to prove to your insurance company that Zepbound is medically necessary for you. You must be able to present a solid case that includes your medical history, BMI, any weight-related health conditions, and perhaps evidence of past weight loss efforts. Meeting the FDA's eligibility requirements for Zepbound is a good start, but your insurance may have additional prior authorization criteria. So make sure to call your insurer first and ask what is required. Generally, to get Zepbound approved by your insurance, you should follow these steps. 1. Check if your insurance covers Zepbound. If Zepbound is covered, it should be listed in your insurance provider's formulary, which is essentially their list of approved medications. 2. Ask your healthcare provider to help you gather relevant data on your medical history, including your specific needs regarding weight loss and any prior treatments you've undergone, for example. 3. Have your doctor submit a prior authorization form to your insurance. This document should clearly justify the need for Zepbound in your treatment and include supporting clinical evidence of its efficacy for your specific situation. 4. Stay proactive with follow-ups. Given that the prior authorization process can be lengthy, proactively following up with your insurance company might help speed things along. What to do if your insurance denies coverage? If your health insurance denies your Zepbound coverage, there are still several steps that you can take to try and get Zepbound without paying out of pocket. 1. Appeal your insurance denial decision. If your prior authorization request for Zepbound is denied, you always have the right to appeal the decision. If you wish to do so, work with your healthcare provider to gather additional supporting information and submit an appeal to your insurance company. 2. Check the manufacturer's savings program and coupons. Eli Lilly offers a savings card program that can significantly reduce the cost of Zepbound, even for those whose insurance does not cover it. 3. Consider alternative weight loss treatments. If you don't qualify for any coverage or assistance and you can't afford to pay the cost of Zepbound on your own, ask your doctor about alternative GLP-1 or weight loss medications that might be covered by your insurance or more affordable. Remember, Zepbound is a long-term treatment. You're probably embarking on months and even years of medication. So it's important to make sure you can sustainably afford this treatment over time. Initiating treatment with Zepbound only to discontinue it after a short period due to financial constraints can undermine its effectiveness. Always plan your finances with the long haul in mind, ensuring you can consistently manage the costs associated with your ongoing treatment. Do Medicare and Medicaid cover Zepbound? Prior to delving into our discussion, it's important to note that extensive research has been conducted to provide a list of prominent health insurance providers, including BCBS, Cigna, and Aetna, focusing on their coverage for the new weight loss medication Zepbound. For detailed information on whether your prescription is covered, refer to the first link in the video description. Going back to the main focus of this section, as of now, Medicare does not cover weight loss and obesity medications like Zepbound. However, recent developments in April 2024 suggest there may be some changes soon. The Centers for Medicare and Medicaid Services have indicated that Medicare Part D medication benefits plans might start covering weight loss medications for patients with specific health risks. But for Zepbound to be covered under Medicare, Eli Lilly will need to demonstrate additional benefits in clinical trials. Currently, the manufacturer is conducting studies to prove that Zepbound can reduce morbidity and mortality associated with obesity, with results expected by late 2027. If these studies prove successful, Zepbound may also qualify for Medicare coverage under the new guidelines. So stay informed and keep up to date with any changes in Medicare policy that might impact coverage eligibility for Zepbound. Although Medicare does not currently cover Zepbound, patients enrolled in certain Medicare Advantage plans or Medigap might be covered, as these plans sometimes include additional coverage for medications not typically covered by traditional Medicare. How to get Zepbound cheaper without insurance? Now, if you don't have health insurance, or you've tried it all with your health insurance, but they still deny your coverage for Zepbound, there are still ways that you can save on Zepbound and get it cheaper. These include the Eli Lilly Savings Card. If your health insurance does not cover Zepbound, Eli Lilly, the medication's manufacturer, has launched a savings card program to help you reduce the out-of-pocket cost of your prescription. To be eligible for the Zepbound savings card, you must meet the following criteria: have a valid prescription for Zepbound that aligns with the FDA-approved labeling for the medication, be covered under a commercial drug insurance plan. This type of insurance is typically provided by private health insurance companies rather than government-funded programs. Not be enrolled in any government-funded healthcare programs, including Medicaid, Medicare, Medigap, Department of Defense programs, Veterans Affairs, and others. Be a resident of the United States or Puerto Rico and at least 18 years old. Eli Lilly states that card savings are subject to a maximum monthly savings of up to $563 and a separate maximum annual savings of up to $7,319 per calendar year. It means that if you're approved for the Lilly Assistance Program, you can get Zepbound for about half of its list price. For more information, you can check out the detailed terms and conditions for Zepbound Savings Care by visiting the description of this video. And here we have reached the end of this video. Thank you so much for sticking around until the end of this video. If you have any concerns or questions, don't hesitate to leave us a comment or watch our other videos on Zepbound. Also, don't forget to visit our website to get your travel cooler, real life savers when traveling with your Zepbound injections. If you found this video helpful, please like, comment, and subscribe for more updates. Stay tuned for our next video.